Hello, hello, hello. Happy Friday. Happy Friday. Happy Friday, my ATHLers. Hi, my name is Abby Tyler. I am your host, practicing family nurse practitioner, content creator, and community health volunteer. Suspending my Friday chat with Abby, and we're going to be doing the second part of the mental health awareness. Today, we're doing depression in women. And I have a special guest with me today, Ms. Vanessa Woods, who she'll be introducing herself later. Before I start, I'm just going to go on like I always do, and just going to cut over here. And in my disclaimer, whatever we say here does not take a place of you seeing your family provider. Please do not change any regimen without seeing your family provider. Okay. And also, mental health is very vast, so we're not going to be able to cover everything this month. There's so many other different shows that have touched on it. So we're mainly going to be concentrating on depression in men today. Okay, and also I did tell you guys there's more to mental health than just depression. You're talking about bipolar disorder 1 and 2, schizophrenic disorder, schizophrenia, OCD, eating disorders, and so many other different ones that you can read about, okay, or speak to your doctor about if you have any concerns about it. Alrighty, so before we start now, I'm going to have Miss Vanessa Woods, who is also my niece. So she's going to introduce herself and give us a little bit about her background and what she does. Vanessa, you want to take over?
Yes, thank you so much. I am happy to be here. So, I am Vanessa Woods Nelthrop. I'm a licensed professional counselor and also a approved clinical supervisor. And I have been in the mental health field for a little over a decade now, which is kind of weird to say. But I specialize in treating depression, anxiety in youth, adolescents, teens, and also adults.
Okay, alrighty. So today we'll be talking about. I'm just gonna load my phone here because I'm just gonna you guys give me one chance so I can just share this video because sometimes this doesn't show up on the other page. And do. Okay, share the group. 1 second. Okay, good. Okay, so as last week we talked about mental health. Tuesday we talked about mental health and mental health awareness and depression in women. So today again is depression in men. I'm going to go back on my notes here. If you see me looking down, please excuse me because I'm looking at my notes and it's on my phone, so it's a little smaller. Okay, so when people come to us and talk about, I see my patients. Like I said, my patient comes to me. They come most of the time. They come to me for different reasons, mostly for medical reasons. And based on what they're telling me and the different symptoms they're telling me, that's when we go into where you have we figure whether they have anything going on. Most of the time, it's anxiety and depression is why we diagnose in the primary care setting. We also work with again with certain diseases it requires a multidisciplinary team, so usually I see my patients and then also some mental health and we both work together, but sometimes we have to put them on medication prior while they're waiting to get help because sometimes it's not available, your therapist and getting people are not available, so I take care of that. Of course, when you come in to see me first, we have to make sure that whatever it is that you're experiencing, I mean, it could be a result of something medical that's going on. So usually, like I said, after I do my examination, we're going to review your labs that we have prior to review any kind of imagings that you had. I mean, like if you had an in-chest X-ray or anything before that, review other notes from other consultation from other doctors that you've had in the past, and then also we'll do some blood work. Some people are just tired. Sometimes they just require like maybe some B12 and vitamin D because vitamin D also helps with your mental health and also medical too. So we do all that. After we get to a point, and then everybody does the PHQ-9, the one I spoke about last time, want to make sure what it is and go over that. And based on the scoring, is what we use to say, okay, this is what's going on. We're going to start the treatment for that, and then also refer you to mental health. Okay, so Vanessa, do you want to do the PHQ-9 or do you want me to do that?
What would you like for me to talk about regarding the
You can just read the whole thing because I have it here too. They said over the past 2 weeks. If you have it there, I can if you I can read it if you want, or you can go ahead.
so for the PHQ-9, the common, questions would be, over the past 2 weeks, how often have you been bothered or experiencing any of the following problems? So the first one would be little interest or pleasure in doing things. And the options are not at all, several days, more than half the days, or nearly every day. There's a total of 9 questions, which is why they call it the PHQ-9. The second question is feeling down, depressed, or hopeless. And then it moves to trouble falling asleep or staying asleep or sleeping too much, feeling tired or having little energy, poor appetite, or overeating, feeling bad about yourself, or that you're a failure, or that you've let yourself or a family member down. The next question is trouble concentrating on things, such as reading a newspaper or watching TV. The eighth question is moving or speaking so slowly that other people would notice, or doing the opposite, speaking too fast or being fidgety or feeling restless. And then the last question is thoughts that you would be better off dead or hurting yourself.
Okay. So, all right. So when we go through that, usually the patients that you see, do they come from the primary care or you get them from where? Because I know you work with young people as well, right?
Yes, we get them from a variety of different sources. So sometimes they'll come to us from a higher level of care, so an intensive outpatient, or they might come from a referral, might come from the school system. So we get them from a variety of different places, and sometimes, yes, also primary care physicians as well.
Okay. All right. So, can you tell me what are some of the stigmas that people face about mental health that would kind of delay them seeking care and all?
Judgment. I think judgment is a huge one. Feeling that somebody is going to see them or perceive them differently because they're dealing with a certain type of issue, or feeling as though they should be tough enough to be able to get through it. And really blaming themselves for not being able to work through whatever difficulties they're going through. Another one is really just culturally, right? Especially in the Black community. We don't talk about our problems. We don't tell other people our business, right? That kind of stuff is in the home, in the house. And so a lot of people aren't used to opening up to strangers because there's a huge challenge with trust, especially when it comes to medical providers.
Okay. Also, you talk about the Black community. You find that also in the African community because you and I both in African community. Do you find that to be even more difficult in the African community?
100%. Yes.
Okay.
Yes.
Right. Okay, and I also in the medical field, in the medical part of the situation, that most men come to us, and the reason why most of them research show them the reason why most of them get undiagnosed or go undiagnosed is because most of them don't come into the doctor's office having the traditional symptoms, like they're not crying, they're not sad, they're not saying things, and so most of the time it's easy to overlook it, and so then it takes a while for them. And usually when things have gone really bad is when people start saying, okay, maybe he has some issues. And for all terms and purposes here, people we're not talking about people who are going out there and shooting up the place. We're just dealing with like the basic part of the depression and then
Mm.
going on. Like again, like I said, this is not all inclusive. So we can talk about everything here today. So that's the reason why most men and especially teenage boys go undiagnosed because they don't come in with a typical problem. Do you find it as a denial when they do come to see you that they still don't have a problem, or they're just there because somebody else thinks that they have a problem?
Especially with our, I would say our young you like our young men, right? It's typically seen as normal. They normalize a lot of the maladaptive symptoms that they experience because they're a man, right? Like we go through this, we should be strong enough to deal with whatever it is that we're going through, and the expectation on men to suppress their symptoms and not talk about what they're experiencing is also part of what contributes to them not coming forward, because they don't want to seem as weak. They don't want to seem as though they're less than other people. And a lot of times in society, people make men feel that they have to show up a certain type of way. So I would say, yeah, absolutely. They try to downplay their symptoms and act like it's not a big deal when in fact it is.
Okay. So some of the medical slash physical symptoms that men come in, because I do have some patients where I go through all this and I'm like, we've already done this. We already done the EKG. We already sent you to cardiology. We already sent you to everybody else and the test results have been negative. Doesn't mean something is not there because sometimes it could be, especially with autoimmune diseases too, it takes a little while to get diagnosed. But most of some of the symptoms that, and remember, some of the symptoms, it's not for everybody. It's not the same thing for everybody. Depression appears differently, it manifests itself differently in everybody. But the common symptoms include racing heart, because sometimes they'll complain of chest pain, get tightness in the chest, constant headaches, aches and pains, digestive issues, as if maybe constipation, diarrhea, stomach ache, reflux, and all of that. Sometimes sexual performance issues, they have low libido or they have no desire, which would be low libido, or having problems sustaining erection, or when coming to the erection, having problems with their family members, and they're feeling tired, which would be fatigue, being unable to sleep, the complaint of insomnia, and or sleeping too much, or increase or loss of appetite. So those would be like the physical and medical symptoms of depression that men would exhibit. What would you say are some of the emotional symptoms? And then I would just add to that if you want me to.
I would say feeling overwhelmed, feeling easily stressed or irritable, feeling like a sense of hopelessness or helplessness. And I would say sometimes, especially now, where we're at in terms of social media, sometimes the symptoms could look completely drastic, especially in our youth, with things like Instagram and TikTok and Facebook and all of these things. A lot of our young men are taught to put on a show, put on a performance. And so they're taking a picture in their new fit and at this party, at this place with that friend. And in actuality, internally, they're struggling. And so I don't know if you've heard of the term, check on your strong friends.
Yep.
That is a primary example of that, because a lot of the times the people smiling the hardest are the life of the party. Sometimes those are the people who struggle the most, and they use things like social media and parties and going out as a distraction from what's actually happening in their life.
Okay. So difficulty concentrating on memory thoughts. Also, we're talking about suicidal thoughts. Like the person I have on my page here, Anthony Bourdain. He was this person who was so full of life. He was the chef everybody knew. I mean, he was. I put his picture because he's so well known, and come to find out when he committed suicide. And it was like, wow, he had everything going for him. He was so jovial. He was so full of life. How can that happen that somebody who's like that would be depressed? And which is what you said.
Mm-hmm.
Go ahead. You want to expand on that?
Mm-hmm. I mean, it happens more times than not, right? You look at even somebody like Robin Williams, right? He was very charismatic and very outgoing. And I think it really is this sense of being alone and feeling like you don't want to share what you're going through, not just because of judgment, but sometimes men don't want to feel like they're a burden to other people. They don't want to put more on other people's plate. And so sometimes they'll refrain from speaking up when they need help, because they'll try to figure it out by themselves, because they don't want other people to feel the weight of what they're feeling.
Okay. And they also have a higher risk of self medicating, and is what can lead to substance abuse. You want to add to
Mhm.
that?
Yeah, absolutely. So when you don't feel like you have anyone that you can turn to, you find ways to cope. And sometimes coping looks like addiction, right? Increase in substance use, whether it's drugs or alcohol, increase in sexual activities, increase in like gambling and making bets, right? And I think that those are some key signs to really look out for, because our men are almost more than 3 times as likely to die by suicide than their female counterparts. And that's because they tend to use more lethal means of action.
And when you say increase in sexual activities, it's usually unsafe sexual activities. So chances are more than likely either multiple partners or they're not using protection or doing things, other things that you drinking and not, doing things that would cause them more harm and the partners more harm. So
Mm.
now we'll go into the triggers, some of the causes with slash triggers. So you can go ahead and name some of the triggers and talk about it, and I can just add to that.
Sure. Common triggers, everyday triggers might be challenges with the family, right? Challenges in your relationship with your partner, challenges at work, workplace stress, feeling overwhelmed by it, loss. Loss can be a big one. And during this pandemic, a lot of people have suffered a lot of loss, whether it was a loss of someone that they know, whether it's a friend or family member, a loss of job, loss of opportunities. So that really is a huge one. Feeling lost in terms of their identity and who they are as a person, not having a lot of supports. That's also a big one. Not feeling like you have someone to turn to because you're keeping so much inside, or you really just don't have the supports. A lot of times, people they don't have family. They have very few friends, or they have friends that aren't dependable. So they don't know where to get resources and where to look for help.
Okay. So financial, you said financial stressors and loss and everything, especially for men when it comes to like when they lost their jobs and they were if they were the sole provider, even if they were part of provider, meaning we're not talking about people who weren't doing anything with their family members, but people who were the husband and wife working or they're the only one working when they lose that income, that also can put people to where when you talk about increased unsafe practices and all that, it starts self-medicating. That can also put a potential for abuse, which can also lead to violence with the spouse and all that, whether it's emotional or physical abuse.
Yeah. Yeah.
Okay. Good. All right. Also, I was reading about that too, and that's some of the things I'm reading about is postpartum depression, and people will think that's only in women, but at the same time, that can also affect men in that because it's like if the woman's going through issues, and also for things like unintended pregnancies, let's say they were going through problems anyway, and the lady gets and the wife or girlfriend gets pregnant. And you're thinking, okay, well, maybe the baby, when the baby comes, everything will be just okay. We'll be just happy to have this new person in our lives and we'll move on. That is not always the case
Yeah.
because sometimes some people say, well, you were together and then you broke up after the baby, but that the baby coming into the situation can make things even more stressful and sometimes very dangerous. Would
Mm.
you say that?
Absolutely, I would.
Okay. All right. So we've done that. And okay. So it's also the other medical reasons to depression, also because if you have any kind of chronic illness, okay, if you're dealing with things like Alzheimer's disease, whether it's you, a family member, if you're dealing with like the death of a child, those can also most times too, when I did my when I do my maternity stuff, most times if it's the death of a child, most times the parents usually end up divorced. At the very strong ones, if they end up going into therapy and all, they stay together, but that can still be real tough. But the death of a child can really put a strain on the relationship because the man is coping one way and the woman is coping one way. And also, they were saying that sometimes the people are like really paying attention more to the woman because they feel that okay, the mother is feeling it more than the man, and so
Yeah.
the man turns to somebody else for comfort, and that can cause a problem because he's not looking for comfort somewhere else. But sometimes it's like okay, where he gets the comfort because nobody sees him as also somebody who's hurting because he lost his child. And other
Hmm.
diseases, other chronic diseases like heart disease, diabetes, multiple sclerosis, HIV/AIDS, hypothyroidism, Parkinson's, anything, strokes, anything that can cause like a long-term thing, pain, chronic pain can also put a lot of damper on, cause of further depression. Also aging. So I've
Hmm.
talked about that last time around. So some of the ways men can cope, you go ahead, you can discuss that, and then I can add to that if you want.
Increasing their supports or reaching out to their supports. A lot of times, people, I wouldn't even just say men, but people have a tough time asking for help. And so, if you do have a support system present, reaching out and letting them know that you need help, that's one way. The second way is increasing those supports if you don't have them. That might look like a support group, that might look like your church community. That might look like your volunteer community. That might look like therapy, because therapy is normal and it is healthy and doesn't mean that there's anything wrong with you as a human being. It just means that you need help. It's no different than going to your medical doctor. Your brain is a part of your body, right? And if you don't take care of your mind, then the rest of your body is impacted by it. And so it's really important to seek help if you can't kick it by yourself. Another thing to do in terms of coping, especially when you're feeling depressed, is to think about the things that do spark joy, the things that maybe you've kind of left by the wayside, because that's one of the symptoms of depression, not really finding interest in things. But the study shows that the initial engagement might be hard. Like, for example, working out. We know that it's good for you, but you don't feel the energy to do it when you feel depressed. But once you're engaged, after that 10-15 minute mark, you tend to feel good afterwards. But it's that getting there to the gym. So you might find a gym buddy or an accountability partner to help you throughout that time. And that goes back to asking for help. But those are some of my favorite ways to help people cope.
Okay. Also, the other ones is you talk about the exercise, seeing and interacting with trusted people. Again, trusted people, like I said it last time, don't just go to just anybody because they may not be giving you safe advice. And also don't go into the arms of another person because we're human beings, and eventually you might fall in love with that person, or sometimes people fall in love with a counselor and all that too. So you want to make sure you draw the boundaries there. You don't want to wait till your depression becomes too big to make decisions. Don't make decisions when you're at the lowest part of your life, because that can cause a problem. Maintaining a healthy routine, like eating and sleeping at predictable times, avoiding substance abuse, exercising. What do you talk about that? Break down when you feel a little overwhelmed. You want to break down your task into smaller pieces and all that. Say, okay, yes, I know I have to do this, but I don't have any energy to do it. So you do a part of it. Let's say if it's like you're doing a paper, get your introduction first. Put your paragraph down, sometimes the conclusion may come to you, you put that down and put it all together. So the same thing in life. If you have to do something, do it a little bit at a time, do it a little bit at a time, and talk to the person that you're with and say, just give me some time to just do this. And they probably you might feel like they're trying to like get you to speed up, and you don't understand what you're going through. But it just, at least the more you're moving around, the better you be. And plus your physical health too, because if you're laying around and you're not moving around as often, chances are you're not eating healthy. You're going to put on some extra pounds, which is not healthy. Forget that, the cholesterol, you put in cholesterol, your A1C, your diabetes and all. And also when it comes to depression in men and coping with it too, it all goes back to when I did my paper. I did a show on adverse childhood experiences. So if that was never dealt with, and if you never learned coping methods back then, it makes it even harder when you become an adult to be able to deal with that. Can you add a little bit to that?
Yeah, absolutely. And I think that that's why it's really important for people, before we even say, how do we cope? We have to first understand what our triggers are, right? Because I can tell you go meditate, but if it's not really the root of your problem, then it's not going to do anything for you. So I think the first thing is understanding what are the things that are causing you to become depressed, right? And you can do that through simply reflecting through your day, whether it's writing in a journal or it's asking yourself questions like, I just got done having a conversation with this person. I just got done going to the gym. I just got done coming back from this event. How do I feel? Do I feel more energized and encouraged and inspired, or do I feel drained and depleted and not good? Right? Because I think that will help you to understand what it is that's contributing to your depression, so you can stop doing those things and replace it with better, healthier habits.
Mhm. Alrighty. So now the part we're gonna talk about now is the disparity in getting care, because what I found in my like I said on Tuesday, I didn't appreciate when people say get help. You talk about get help. I didn't appreciate the gravity of like not having enough mental health providers, because I send people, send them and say go ahead, and I'm sending you there. We start you the medication, but I do need you to follow mental health, because if you don't, I still have to see you more often, because if I put you on medication, I have to see you more often if you're not also following up with your mental health provider. So, and they come back, oh, we've been trying to get somebody, we've been trying to get somebody, we've been trying to get somebody. And it's like they're not getting the help that they need. And the medication is not, even if I put you on medication for your heart, your blood pressure, you still have to eat healthy, you still have to do this, you still have to do that. And if it's at a point where it's not controlled, I have to send you to the cardiologist. So the same thing when it comes here is not always available, and I there's not much more we can do about it. Even if I tell them go to your insurance company, look in the back of your card, call your member services, and see if they can call you and they can find you more providers. It's not They're not there. People are waiting months and months and months to get that help that they desperately need. So what can you add to that? What can you say to that?
It's one of those things that really tugs at my heart. And it's one of the things that I'm really passionate about. And it really makes me frustrated because it's a systemic issue. There's so many layers to this, and I don't think we have the time here today to go into all of it, but there's so many things at play. The first is not every provider takes insurance. And the reason for that is some of these insurances make it really difficult to do the work that you're needing to do, meaning get reimbursement. People say, oh, it shouldn't be about money, but your providers are people too, and they have to provide for services. That's how you get to go into the building. That's how they get to hire people to see other people. And so, number one, the reimbursement rates are low, and the paperwork is a lot. And so I think it really discourages a lot of providers from taking on insurances. But what that does is it reduces the pool of people that's already small to be able to take on people who need to use their insurance that can't afford to pay out of pocket. So we're seeing the middle class, the upper middle class, and the wealthy be able to have these services. But for the ones who are less fortunate or don't have much, there are definitely longer periods of wait time. The other is it's a shortage. There's not that many counselors in the field right now that are available. The number of people that are needing services outweigh the number of people providing services. And that right there already has a disparity within itself. In addition to that, you have restrictions on who can practice where. And so let's just say I'm somebody who lives in Georgia or Maryland, right? Not too much different from Pennsylvania or New Jersey. The laws are entirely different and the reciprocity is very different. So if I have space in my caseload to be able to take on new clients and I'm not getting anything in Maryland, I can't service anybody in PA and New Jersey. I will say there is something that's called the Compact Law that has been signed into legislation, which makes it a little bit easier for licensed professional counselors to practice across state lines. But the challenge is your state has to opt in. Pennsylvania and New Jersey have yet to opt in. So that means if somebody has availability in Maryland to see you via telehealth, right? You can't see them if you live in Pennsylvania or New Jersey because the laws prohibit it. There are other people who do counseling. So there's LCSWs, we have our social workers who also provide services, marriage and family counselors. Their laws are completely different. We're all doing the same level of work, but the regulations surrounding it is completely different for every one of them. So it's a lot of politics involved in it. It's very systemic, but at the end of the day, the client always suffers because
Yes.
they're the ones who are needing help. They're the ones who are seeking it. And if you're somebody who's going through depression and you can't be seen until 6 months later, that's obviously a problem.
Yes, yes. And it was an analysis by the Kaiser Family Foundation found that more than 119 million Americans live in mental health shortage areas, and only 26.9% of need is being met. The National Council for Mental Well-being reported that 77 of counties in the United States are experiencing a severe shortage of mental health providers. So, and then also now with COVID, when COVID came by, I mean, it's like, oh, everything was just, it was everybody who came to me was had some issues with depression, and then you just like you can't find somebody. And then not only just with depression, because remember, like I also spoke about earlier, there are other mental health diseases too,
Mhm.
diagnoses that weren't being met, and people come to me with ADHD, and I said there's certain medications that we cannot start in the primary care. I can continue it, but at the same time, I tell you I can continue for a short period of time. You have to follow up with your with a provider, and I can find somebody. I have some patients that they haven't been able to find anybody, and some of them also go to like therapists or psychiatrists online that also work. I guess they have the license to work in many states, like you said, but then some of the psychiatrists also don't write medications. And I'm like, well, what's the point of seeing a psychiatrist if they don't work, they don't write medications? And they say,
Mhm.
no, they don't. And they want me to come back to my PCP. So then right away, I'm taking on that responsibility. And I say, and they're not getting the therapy that they need from me because I'm seeing you for 15 minutes.
Yeah.
It would be nice to be able to sit there and talk to you, but I'm not training that. I'm training like, the amount of training I get, but there's certain thing that's outside of my scope for practice. I don't want to just see you for a short period of time and say, okay, everything's going okay. Of course, I have to make sure that you're not going to be suicidal and all that. But I just feel that if your knees hurting you, I'm sending you to orthopedic. So I want for the mental health provider to be available if your brain's hurting you.
Yeah.
Unfortunately, that's where we are. So what would you, this is where we come into the politics, but not specific politics. But so what would you want the general public to do to speak to their politicians on how to get more help and more providers for mental health providers?
I would say advocate. There is what I just mentioned about the compact law. Pennsylvania, New Jersey, Delaware, all the tri-state has yet to opt in to this. This would greatly be able to assist folks in getting additional help if they can't find one nearby. I would also encourage people to understand the laws that impact them and write to your state representative, write to your governor, and voice your concerns and your opinions on things because they do listen to their constituents. But if not enough people are making noise about it, then it gets swept under the rug. I know everybody keeps saying mental health crisis, but not everybody is trained in mental health. And so they're not um, understanding of where to actually make the help and where the impact needs to happen. And so for those experiencing mental health challenges, it's really important to say and ask for what you need.
Okay, so going back to and so men, the males out there, the men, when you do go see your doctor, when if there's something you're thinking about, making sure prepare for the visit, list all your medications. Like I said before, I'm going to be checking to make sure it's not something medical because some medications can also induce depression.
Mhm.
Make sure you're honest about it. Consider bringing a friend or a relative for support because sometimes, again, you might say. I don't want anybody, but somebody who you trust can come along with you, and usually, if you tell us you bring in somebody and you give us consent, we usually the person can come in and sit there and listen to that and ask questions. Make sure you have the best thing. I always tell people have your questions written down. So when you come to see me, That way you're not saying that, well, something else. And write down your triggers, write down what you're feeling this, the time it started. I go back to when you come in, we do a history of present illness. Tell me when it started, what triggered it, what, because I usually, when people, when they say stuff, I say, so what happened in January when you started feeling this way? Usually then they can go back and say, okay, this what happened, or what happened then, what happened in your childhood that's caused this. So make sure you have all that information written down. You're not going to remember everything, but try to write down your triggers, things that happen in your life, and how you cope in the past before. Because sometimes it's like you can work on what you've used, the methods that you've used, and we can just work on that to
Yeah.
make, and also sometimes we may have to say you have to bring a family member in, because it could be somebody else in your household that's causing that, or it's
Mm.
important that the people in your house or your spouse and all can come in there. But then that goes back to the point where we say it has to be like a different visit. It can be a 15-minute visit. So if you call in for that, you want to make sure you call in, because I'm calling because I want to talk to the doctor, because I have an issue with my emotions and all. So when we're not scheduling for 15 minutes where we just doing it what we have to do and getting you out of there. We want to make sure we have enough time to talk to you so you can leave there safely. And also for crisis center, I think we only have one crisis center in this area. That's the one in Bristol. So I mean, most of the time it's like you don't have too many crisis center. Because I remember when I think in Philly somewhere, and they're like, "Where's the closest crisis center?" I said the only one I know is all the way in Bristol. So that was all the way in Northeast Philly. So we need to advocate for more of the centers as well, because sometimes, I guess, the patients will come to the office, and if, after I go through certain things and I'm asking questions, if I absolutely have to call the crisis center, I have to call the police. They have to take you out of there, and not arresting you, but making sure they're taking you to somewhere where you're safe. Because we always ask that, do you have any suicidal or homicidal ideations? Once again, and most people who is very suicidal, they may want to kill everybody or the people closest to them, because they feel, okay, if I'm suffering, I don't want to leave my children behind, I don't want to leave this person behind. And also if they're dealing with anger issues, so that can also cause a bigger problem, because we see it every day: suicide, homicide. So yeah. So anything you want to add, and also so we can wind down, because I don't want to keep you too long.
I think, the thing is, as great as crisis centers would be, the issue is a lot of times when people get to crisis centers, there's no availability of beds. So where are you going to put them? A
That's
lot
why
of times people camp out 24, 48 hours just waiting for a bed to open up. And it's nice when they have people who can stay and advocate and call this place and call that place and try to coordinate care. But a lot of times some of these people who are experiencing crisis don't have that level of support. And so they end up walking out AMA, and they don't get the help that they need because they're frustrated. So it would be nice to have more crisis centers, but we need more beds, and then we need more people to staff it. So it goes back to the same shortage of providers all over again.
And which is one of the things I saw when I worked in the hospital, where have people there that came in with these suicidal ideations or even suicidal attempts, and they have to be medically clear. So after they're medically clear before going, and then when there's no beds at the different hospitals in the area, let alone crisis centers, they're not there. So they're in a hospital and they're mad because they're in a hospital, and they're being poked and prodded every day for blood and this and that. And it's like, okay, that's not what I came here for. I'm fine to go home. But you can't go home, because sometimes they're 302, meaning they're under psychiatric hold, and they can't go, and you have to be under suicidal watch. They can't stand the fact that somebody has to watch them, even if they go into the bathroom. And so they feel like they're losing. Yeah. And then chances are more than likely, if they do go over to the psych facility, not the crisis center like a Friends or Beaumont and all that, if they ever come into the same situation again, they probably won't tell anybody, because, oh, I know what you did to me the last time. The last time I said I was feeling this way, you grabbed me, you had me over there, and people were watching me the entire time. So that's why it's important to have more of these providers, so they can go there, and so we're not getting to that point. Okay, so go ahead, go ahead.
No, and I was just going to say, revamping the way that we do inpatient care, because it is something that feels really invasive. And a lot of times it feels very sterile, it feels very cold, and people don't want to go into those places. But if we make it feel more welcoming and we make it feel, better, a lot of times too, when you go in there, the staff is overworked, they're understaffed, they're working doubles, they stressed out. Are you going to get the best level of care? Probably not. And so, people go in there and they don't really get much from it. So people say, why am I going to go there? The people running the groups weren't helpful. They were cranky. My individual counselor has 200 people, 300 people on her caseload. So she can't see me often. They can't really see them as often as they need. It's really, really frustrating. So we have to revamp the way that we even do treatment.
And what you're saying is very important too, because when I have patients, when they come to me and they're saying, "Oh, I didn't get along with my counselor, I didn't get along with my psychiatrist," and their relationship between, especially as outpatient, the relationship between the counselor, the psychiatrist is so deep with the patient, that patient to counselor, because it's, at least with me, you see me for 15, 30 minutes depending on why you're there, but it's like you telling somebody else your deepest and darkest thoughts. And so if you don't get that connection with that person, then half the time, like, oh, I don't want to go to anybody else. And I definitely don't want to go to group therapy. And I don't want to do that. And I don't want to do that. And I really like this person I was going to before. And then, we didn't care for them. So it's just, then it's like, okay, you're back in the primary care setting again. I can only do what I can do until you find somebody else. And sometimes, even when they move away from somewhere else, again, going back, oh, I moved from New York and I move over here, I have to start all over to find somebody else again. So it's just, let me check our comments and then we can make our final server. Okay, so let me see here. I'm just going to open up the face. So Jackie, as you say, yes, she's a social worker also, and it's Facebook user. I have my page open up another things to say, can mental health issues be treated without medications? Very much so, very much so. We have a lot of ways. I mean, we talked about, like I said in last time, yoga, making sure you have a good support system. And sometimes, depending on the medical issues that you have, I can really prescribe this first set of medications, the guidelines for depression, anyways, because your medical care is going to contradict that. It's going to be, you can't have this medication because it interacts with this, it interact with that. And some people, if you prescribe the medication, they won't take it anyway because some of the side effects, low libido, sometimes lethargy, mean sleepiness, and all that. So there are many ways that it can be treated. But if after the examination and all, you found to need the medication, yes, we're going to prescribe it and we're going to encourage you to take it. It doesn't kick in for at least 3 to 4 weeks, anyways, and then we see you back in the office. It's not something that you're going to take forever. Sometimes the depression you go into is very episodic. So whatever it is that's causing the problem over a period of time, if it resolves, you don't have to be in that medication. So it's not something you're going to be taking forever. But there are many ways that it can be treated without medication. Anybody wants to know that, I said that in my other show too, where it says non-medicated ways and then medication ways. All right, so I'll check on. Remember this person, Master Doctor said, what's it said? It depends on the issues. Yes, depends on the issue. Depends on what, like I said, examination. And so many other, again, bipolar, ADHD, excessive substance abuse. Those are things that you need to have the medication for in addition to the counseling. And Jackie Jackson said, great topic, Abby Tyler. Can you continue the topic often? Give this word what is facing? Yes, this is something that we have to talk about more often because we see so many people coming in all the time. And even though you come in for medical issues, sometimes my patients are sitting there and all I have to do is just ask them one or two things. And right away we go into deeper conversations. So yeah, so we always bring it up. That's one thing that everybody now is like guidelines. Everybody has to fill out a PHQ-9 because before it was like, okay, that's not why you come in for, but every patient fills that out, and the alcohol thing and all that, because sometimes you listen and you're like, oh, okay, you had all that going on in your past, and you only thing you have is all your medical issues because we never addressed it before because you came in for something else. So that's something everybody has to talk about against with the advocacy and all that.
Great.
Okay, and this way we used to say is eye-opening, the level of hurdles and frustration of patients. Yes, yes. I mean, sometimes I sit there and I'm very frustrated because they come back to me, over and over and over again, and they can't get the help, So we playing a part of that. So I mean, once again, go back to making sure those who are out there who have family members or friends who are going through issues like this, speak up, go to your community meetings, send letters, and all that. Go to your community meetings because sometimes they need to see your face because sometimes they don't read the letters, or if they read the letters, like, okay, there should be the face behind the letter. So it's very important that you do that.
Yeah.
I think I got all the questions there already. So, all right. I mean, it's a very important topic. That's something that needs to be talked about very often, frequently as well. So we'll come back and forth every once in a while. And I can have you back here again someday if you want to bring up any topic that we can talk more about.
Absolutely.
So, okay. So, any final thoughts, Miss Vanessa Woods Nitro?
I just think that taking care of yourself, especially during this period of time that the world is going through, as one of the viewers mentioned, is incredibly important. There's nothing wrong with admitting that you need help. We all need help. We're all human and we all fall short. So, getting the help and support that you need can save your life and also change the direction that you're headed in, and it can set you up for success. So if you're needing additional help, some good resources in finding a good provider is Psychology Today. You can go to psychologytoday.com online. There's also a nonprofit organization that provides free mental health services to men of color, Black men. It's called Black Man Heal. They offer Sundays, they have groups that are virtual called the King's Corner, but they also provide therapists that are also of color, because we know that representation matters to men seeking counseling and services. There's also my organization that I had called South Jersey Coping Clinic, and we're located in Marlton, New Jersey.
Okay. All right. And also, you can, like I said, you can also get all the care from your family provider. Ask them, and they have all the different resources. And also, look in your back of your insurance cards and look for member services, and you can call and do that. So. And also, if any you have any thoughts of suicidal or homicidal ideations, please call 911. The suicide hotline 24/7. I put that on the screen the last time. It's 1-800. It's toll free. 1-800-273-8255. That's 1-800-273-8255. Please do not be ashamed to call if you're having any issues. I go on there and I see people. Sometimes I just read my stories. I read my Facebook news feed and I'm like, and I said, sometimes, and I don't bother people. I just say, sometimes I say everything okay. Like there was, like I tell people to start, posting differently or being away for a while, so you just kind of look and you don't try not to get into people's business, but at the same time we all want to look out for each other. Okay,
Mhm.
and my cousin said self-care, so of course, yeah, self-care, because you want to make sure you're going out and go into the waterfront. Like I do, I go to waterfront, I walk in the park and do things that and get friends along, people who really love you and care about you. So get people close and get your close friends in your circle. And there's some people who don't have that many friends, but you know what? That one friend is always better than 1,000 friends that's just going to be there just for the good times.
Yes.
Okay.
Can I add something very quickly?
Sure, sure, sure.
So the new they have a new suicide number in addition to the one that you use. So it's 911 for mental illness. It's 988. And so sometimes people don't have time to search and look for the suicide hotline because they're in crisis. So they can dial 988 and it will direct them to the suicide helpline. It's 24/7, or their nearest crisis center. So they can dial 988 and it will route them to where they need to go.
Just right away from anywhere.
Anywhere in
Yeah.
the country. That's nationwide.
Okay. Alrighty. So good. Alrighty. So 988 is the suicide hotline. Okay, so you can call
988.
that and then convert already. So good. So I hope everybody what we said here today has helped one or two people. And please, please, please share the video, share with your friends and family members and all that. And again, talk to your family providers. Talk if you have to talk to your pastor. I always say I have nothing against religion, but you want to make sure it's a trained pastor. Don't get one of those people who just went to school for 6 weeks and then all of a sudden they're telling you things that they're not safe. Go to somebody who's a trained pastor to do that, who can tell you, okay, this is what I think you need to do. And they took counseling, they took psychology classes, so they know developmental psychology. So they're not just saying, okay, this, all right, because we all know, but the most important thing is keeping you safe and keeping your family safe. So thank you all for watching. I thank you so much, Vanessa, for coming on here.
Thank you for having me.
Okay. I really appreciate it. So, oh, by the way, people, I've been knowing Vanessa since she was like tiny itty bitty baby baby, and we go back with politics and all that too. So, but thank you so much for coming on. Thank you everybody else for watching. I will be back next Friday for my Fridays with Friday chat with Abby. But Tuesday I'll be back with another show at 7 o'clock. I'll be putting the flyers up later. So thank you all for watching. If you have any additional comments or questions, just please put it below. And also for those of you who have family members who are not on Facebook, I am also, you can also find me on Twitter, or you can find me on YouTube under the same name. Please like and subscribe and turn on your bell notifications, and also on Facebook as well, Abby Tyler's Healthy Living page. Okay, thank you all. Thank you all. I appreciate you, Vanessa. Thank you all for coming on. And good night. God bless. Take care. Thank you.